Greetings. Greetings, people. Once again, it's Saturday afternoon. What's today's date? Is it 28? Yes, today is Saturday, the 28th of March. Greetings once again, people. Hey Google, turn volume to 2. So when you come on, share with your friends. You didn't come on kakra because I'm really COVID that kind of shit. You know, the topic for today, we're gonna see how our leaders are responding to the issue. Are they doing the right thing? Is it, you know, what are our responsibilities? What do we have to do to make sure that we are all on the same page in trying to alleviate or get rid of COVID-19? So if you just join in, this is your friend here, Kwame. I'm going to talk to you today once again about COVID-19 and what you need to do to prevent yourself. So let's wait for others to come in. Hey, Kwame, how are you? Letitia, welcome. Hey, Google, turn volume to 8. Jackie on the case. Share with your friends. Let's talk about COVID-19 and how this administration is handling this issue in Ghana. You know, and you can also type your comments and we will read it out. We all want to chime in. We want to say something about what they're doing. Is it the right thing? Is it a good thing? Are we under control? Is it a need to panic? We're going to talk about all of that. Nanaya, how about you?
I'm connected to you, girl. Can feel the power just like you next to me. I'm up in your galaxy, you be my world. Don't make a move unless you say okay.
Alright. Hey Google, turn volume to 6. Yeah, I love my music.
Sorry, the max volume is only 10. So, what level do you want to set it to?
6. You know, music is for the soul, so you can't do without music. Looks like I'm sorry. So yesterday we were here and talking about people crowding in places which wasn't good. So okay, Jackie, slow down. Yesterday, in the afternoon, I was on Facebook talking to my fellow Ghanaians, my people, how people are still crowding in marketplaces and stuff like that, and suggesting that, look, this place should shut. We can't do that. It is dangerous. So let me take you back to the video and let's see what I was talking about right here. Oh, my thing.
If this video is actually what is happening, then we got a job to do.
Turn up the volume.
So, like especially
Yes, right. So yeah, yesterday in the afternoon I was sitting right here talking about how dangerous and how serious it is for people to be still going around doing their business as if nothing is going on, right? And then during the same conversation, I talked about economic stimulus. My argument was governments all over the world have been affected by this problem. So governments are trying to do things to help their fellow citizens, to ease the pressure on their citizens. And I cite an example of Ghanaian political parties. When they come for your vote, they will be like, oh yeah, my party, I dream nipa, yeah, dream nipa. We have compassion and all sorts of things. So I was challenging that this is the time that a party has to show that to the people of Ghana, that you are a party with, some sort of compassion for the people. And guess what? Lo and behold, yesterday before I went to bed, I heard the president has addressed the nation. And listen to what the president had to say. Let me look for this video.
Good evening. I've come to your homes once again, as promised.
President
On
Nana
a matter which continues to grip not only the attention of the nation, but also of the entire world. The coronavirus.
So Nanado came in and spoke
At the
to
time of
the
my last broadcast,
people. Let me forward it. Something that
limit and stop the virus within our country have lost their lives. I said before, all the government is doing is intended to achieve 5 key objectives: limit and stop the importation of the virus, contain its spread, provide adequate care for the sick, limit the impact of the virus on social and economic life, and inspire the expansion of our domestic capability and deepen our self-reliance. Thus far, we have succeeded in halting any more importations of the virus into our country. And I thank the overwhelming majority of you for adhering to the good hygiene and social distancing protocols announced in my first broadcast to you. However, prevailing circumstances mean the stricter measures have to be put in place to contain and halt the spread of the virus within our country, especially in Accra, Tema, Kaswa, and Kumasi, which have been identified by the Ghana Health Service as the hotspots of the infection.
All right, folks.
Doing this,
thank you, Nana.
We cannot.
So there you go. That is leadership. To me, I'm not here to campaign or anything, but from the explanation that the president gave, we have places that have been identified as hotspots. So the health services say that, look, these places are hotspots, we need to close them down. And that's exactly what he's done. He's asked them to close these places down. They made suggestions to restrict a movement of people. I heard some people saying, oh, is it only Accra and Kumasi and everything? But the point is, Koforidua is in between Kumasi and Accra, but it wasn't identified as a place to lock down. I think it's based on the judgment of health officials and the amount of data that they have. That is why they made that decision. But I want to applaud the president for taking that bold step. Like I was saying yesterday, Ghana is an economy. Ghana is an economy that thrives on the private sector. So to tell the private man to close his business and stay home is not easy. And this government or this administration has shown that boldness, has shown that leadership quality, that they are willing to handle the situation. I was also impressed about how the initial control started. When the news broke out, we made sure that anybody coming into our country, our borders were closed. That's the first initiative, and that was I think was very, very fantastic. To close our borders, to make sure that people coming in are checked before they come in. And as we speak, all the cases that we have in Ghana are cases that were brought to the country. But it's obvious that the disease comes from outside, comes from Asia, China. So definitely, it didn't start from Ghana. So definitely, it's going to come from somewhere. So yes, it came to us, and then that's what the health department and health services are saying. So it's very good. The administration is taking good care of the situation and handling it and staying on top of it. We're gonna go for a music break and we continue with our conversation. So guys, let me hear from you. What do you think about the way this administration is handling the COVID-19 disease in Ghana? I want to read your comments. In my point of view, I sat here yesterday talking about the need to shut the market, the need to shut public places, the need to reduce public transportation, and I heard that from the president yesterday. That is impressive. That is bold leadership. I mean it. I mean, give credit when credit is due. You know, that is the way to go. I'll come back and talk about what I'm not really impressed about, the way we are spraying chemicals in the open air. That one, I think there's an issue with that. We want to disinfect, but we're thinking about the mode of transmission. You know, it has to touch your hand and has to touch your mouth. No, so spraying in the market and on our fruits and our vegetables and our bananas and our nkontomires in the air, that one we have to be a little bit careful about that. So yes, welcome guys, thank you for watching. Let me read your comments right here. See what you think about how Nanado and his men, his health officials, are handling this issue right there in Ghana. Kakra Soro, how you doing, brother? Duchess, how you doing? I remember your post, my dear sister. You said what? The problem with Ghanaians is that when you say nobody should go out, everybody will go out to see if somebody came out. That was really funny. But people are actually staying in. From the pictures that I'm seeing today, it's impressive. It's different from what we saw last time with people crowding in marketplaces. That was a little bit scary. But now we have seen some bold leadership decisions that is asking people to stay in regardless. So just a disclaimer, no rights for the music playing, it's just so you know. So as I was talking about the health impact on the economy, I was also mentioning the economic impact. You know, Ghana driven by private sector, you know, huge majority of the people employed by private people. So definitely government is going to feel it. I mean, the people are going to feel it, you know, when we have a recession and all of that. So this is what I was saying just before yesterday. I mean, just before the president address. Listen here on the video yesterday. Business are going to get hit. I don't know if the effect is already felt in Ghana right now, but in the West here, it's just rapid. It's just, you know, very sensitive to these kind of changes. So I don't know how the economic situation is in Ghana right now, but definitely if the world is running into a depression leading to a recession, then definitely we're gonna feel it. We're gonna feel it in Ghana. So what is government gonna do? This is what usually politicians campaign on. See, I buy or drink, I buy or tema, or be up a sort of way, I buy or tema. Okay. So right now, in Nipa home, but there's going to be depression. People are going to lose their jobs. People are going to lose their income and a whole lot of things. So what is government going to do to help these people? Because you see, to say I buy a boca. Everywhere, America, for us, you're more discard a credit to go football to be sending away on all over the world. There's going to be some sort of
package be for people so that they easy the pressure on the people. So right now, definitely it's gonna be the order of the day. Abaya Boka, it is to see how the answer say we are responsible say abaya the package beer bit easy and impact pressure kakrana, because we have to think about that one too. You know about the prevention, the basic the big for public health campaign and prevention and everything. But it's going to hit the economy too. So when we are talking about the health impact, there's also the economic impact, which is going to hit the private people, the businessmen and everything. And Ghana is difficult. You can't give money to people like America can give money to people because of data and all those type of things. But we all know, baby, Ghana, you hit it. The ordinary Ghanaian more is the price of petrol. You know, say, I want to buy any secret and I also know it if I can't. Yeah, it is if I buy, you want to be a little bit considerate now because we are living in hard times now. I think, say, my humble suggestion is, if it hasn't hit Ghana yet, and whenever it hits Ghana, there, I think the government should consider some sort of economic relief for the people, and this will help the government in the message to the polls. So when the crisis.
So everything I said in you. So I was sitting here yesterday suggesting that the government should have some sort of relief for the people, because obviously there's going to be some sort of economic hardship as a result of COVID-19, affecting businesses, affecting the global stock market and everything.
On businesses and households.
Listen to another.
And ensure the job losses are minimized. The Minister for Finance has been directed by me to prepare.
I think I need to take this back. I need to take this back.
Coronavirus alleviation program.
So what the president, it looks like he heard what I said. And I can promise you, I had this suggestion a couple of hours before the address. I don't have any links with the Jubilee House or anything. But I was so surprised that the two things that I showed concern about were directly addressed by the president. I was impressed. I am impressed. I should be honest with you. With Akufo-Addo, when he came out with a package. It's not done yet, but for us to have that coronavirus alleviation program to go to Parliament, and I don't think it's going to be a big deal for the opposition to approve or anything like that. But to alleviate the economic impact, trying to give 1 billion cedis for business and household, that one we don't know how this money is going to be shared with households in Ghana. Maybe if you how the household thing, because you have to see peace in Ashtown. And when you talk about households in the FBM, we have more families in one particular house. Maybe about 10, 15 families in one house. So that's another case. Maybe I even can have fast I chess household be any. But the interest rate conforma, it will have that kind of ripple effect, on other people. Amount for some benefit. So if they see 2% increase, 2% decrease in interest rate, that's an economic relief. They put in relief on tourist accommodation services, Uber transport, or more running hotels and all those type of things. That is an economic relief. Mobile money. Government president says you can send mobile money up to what? Up to 100 cities for free. That's a relief, because Obi Ohana Nisika was sending doors until yes, Obuano. I mean, Obi Anisika was sending a kakra 20 cities, 30 cities. A handful woman a geomokasi, or almost send a casino and come on mokasi. So I think we have a president who's ready to listen to the people of Ghana. And as a people, we have to listen to him and we have to support him. I strongly believe that hey, Mami Ama, how are you? I strongly believe, in my opinion, that the president or the administration today is handling the coronavirus effectively. That's my point of view. For the fact that we're able to close our borders, the fact that we're able to spend money to put people in quarantine and checking them before releasing them into the country, that was a bold attempt. That was a bold decision, and I applaud the administration for that and the people who are with the president trying to help him to come up with those decisions. So yeah, let me play this again about what the president said about businesses, his support.
Neither is it, as we have seen, a respecter of person. The enemy is the virus and not each other. As I've stated in my earlier broadcasts, all the measures I have announced tonight will be subject to constant review. Fellow Ghanaians, we are in this together, and the government will stand by you. We are aware that there will be discomfort and difficulties for all of us over the next couple of weeks. As a responsive government, we will continue to implement bold measures to mitigate the impact of the coronavirus on businesses and households and ensure that job losses are minimized. The Minister for Finance has been directed by me to prepare for approval by Parliament a coronavirus alleviation program to address the disruption in economic activities, the hardship of our people, and to rescue and revitalize our industries. It will then immediately make available a minimum of 1 billion cedis to households and businesses, particularly small and medium-scale enterprises. The commercial banks are, in addition, responding to the Bank of Ghana's 1.5% decrease in the policy rate and 2% in reserve requirement, with a 3 billion cedi facility to support industry, especially in the pharmaceutical, hospitality, service and manufacturing sectors. We're providing additional relief, such as extension of the tax filing day from April to June, a 2% reduction of interest rates by banks, effective 1st April 2020, the granting by the banks of a 6-month moratorium of principal repayments to entities in the airline and hospitality industries, i.e. hotels, restaurants, car rentals, food vendors, taxis.
There you have it, folks. There you go. Economic stimulus. Country behind how they can issue economic stimulus to the people. And I think this is our way. Anti petrol bo na wadaro ma se ka petrol si twaso kakra so bo anka ba bo Ghana na kwan na e fa so ti petrol so na me say the metrics and the algorithms are a little bit confusing. I say do see a better so I na technicalities in the doors on the door. Say e betum di aye tum ntem do. Enti no no say e be se kakra say e be hwe petrol na ko petrol no de e uti so e kan bi easily. Yeah, I think people of Ghana should be grateful. We are in good hands. The issue is going to be in control. One good thing about corona is a lot of people who will be exposed to this corona will recover. This is not life and death. It's not everybody who gets exposed to corona that's going to die. No. So my advice to you is to keep your immune system up. Exercise. Eat well. Keep the chemicals away from your food. Don't spray the disinfectant onto your food item, onto your fruits, your apples, your bananas, your grapes. Don't get the sanitizers on them. Okay? And we should be all right. Jackie, more music. Hey, Google, turn volume to 8. Yes, so how we've handled this situation so far, like I'm saying, I'm impressed. President's talking about public health prevention, which is the ultimate thing. Yes, Kwame, I agree with you. Kwame said, I think he has pretty good job so far. Yes, Kwame, I agree with you. I mean, the president has done so far so good. For the fact that we stopped checking it from the borders, from the airports, was a good start because, the disease, everybody who has it is a case that was brought into the country, which is obvious because China is not Ghana. So, yes, I think that is a plus. I'll give him A+ so far. But there are other issues as a public health professional that I want to talk about moving forward. But mpanyinfoɔ bu baby say yɛngyina nkrane mu ntutu nkrane, and so eduru hɔ a yɛbɛka. Nana Wadie, how are you doing? Yeah, Mitieni Kakrebi is the issue of infectious disease, infectious communicable disease. Abefo panic so much because omatra that level of infectious communicable disease. Nti ye omonwa say yare free enipa ko nipa ho ekum nipa omatra. But when you come to our side of the world, yare free nipa ko nipa ho ene kunye kese. Enu ne kunye kese. Nti we say I say nwanwa so nwanwa. Be honest with you, because our cholera ye fin e deba. Itimi kum nipa. Ghana Health Service that they can give you the data every year. Nipa cholera kum disgraceful. Malaria and tuntum abuan tuntum malaria. Like I'm saying, we will go more into that because I know COVID-19 and some number. The CDC that we see in Atlanta here was built to eliminate malaria from the south. That's the whole purpose of building CDC. Because after the Second World War, there was a lot of mosquitoes around in the south. And so the U.S. government said, look, we can't let this tiny mosquito control our lives. So we have to get rid of this animal. That's why they built the CDC to start investigating and trying to research into how we can get rid of it. This project is doable in Ghana. I'm very well, Nanawade. How about you, sir? It's doable. We can get rid of mosquitoes. Our health ministers, everybody knows it. It is money, just like we are getting rid of COVID-19. We will get rid of it in Ghana. But we don't have to still live with malaria. Malaria should be a thing of the past. A man for say a business, a BCA say, but a cost watch it. So you share the number of people, the number of lives that we lose every year as a result of malaria, the amount of money that we spend in prevention, the mosquito nets, all those kind of things are too much. There is a way to eliminate malaria from Ghana, and we can do it. We are capable of doing that. Just as USA, Georgia on the same latitude, almost the same latitude with Ghana, almost a tropical, country, has hot climate. Eriabo has which have thick forests and everything, which has the environment for mosquitoes to grow. But if this is a mosquito that can give us a disease, we will eliminate that mosquito. We will need the insects to pollinate the flowers for us to get our fruit, peaches, and everything. But we don't want an insect to be a vector to carry diseases for us. So as humans, if we live in a country that we have an insect that carries disease, we can get rid of that insect. There is a way to do that. And the health professionals and the biologists and all those, they know it. It's just a matter of, we can get rid of it. Let me give you an example. Last, how many years ago? Is it 2 years or so when I heard of Zika virus? That was a vector-borne disease, a disease carried by a mosquito. You know what we did? We made sure that we eliminate this mosquito from the country. If anybody gets sick of the hospital, if anybody gets sick and goes to the hospital, the doctor will report back to the health department. The health department will go to the person's neighborhood and spray the whole neighborhood. What will they do? It we are now call hospital and says Zika nibi no one says okay, tuntum nibi wo area muho. And as I tell ya show address near the address na health department environmentalist no maba. So area ha na ya share a normal air course the harborage. The things that are kind of leading to the harborage to the infestation. And we will spray there. And also educate the neighborhood. We have flyers. We go door to door and tell people that, hey, we have one case in your neighborhood. So you got to be careful. So everybody becomes vigilant. So it's a matter of government department and the community working together to eliminate Abua. Because the Nipa, they are higher for Abua. Look at how mosquitoes everywhere. This small, tiny, in this day and age, we can do that. And so, and when you welcome BBC, strike the iron when it's hot. Right now, that public health is on the map in Ghana right now. Let's take advantage of this campaign for COVID, translate it into eliminating malaria, typhoid fever, hepatitis. These are communicable diseases as a result of unhygienic activities. And we can eliminate it. The number of people are omewu for typhoid fever. Look around your neighborhood. Who you Ghanaian? Look around your neighborhood. The person that you knew who died of typhoid fever, and now you come to this world and realize, typhoid fever. Why should this thing kill somebody? Oh, obiewu of a high blood pressure. Just a normal be or normal. We don't have to die. Any can see you, but you. So my case more OJ Platini. Yes, sir. You know. And maybe we have to work towards it. Let's use the campaign for COVID-19, translate it into malaria elimination in Ghana. That will be a plus for the government of the day. If we are able to eliminate malaria or reduce it drastically, we know the numbers, how many people are dying every year. The hospitals can tell us. I don't want to give any fake number, but we are talking about thousands. And so if we are afraid of COVID-19, we should be afraid of malaria as well and get rid of malaria. It's affecting productivity. And tontom you will be a day to me quadruma and hope. Be uncle bit my coy juma de infaswa abefian, Nantontum, Arino, Abuantontum. We can eliminate that, brethren. So let's work together on that. More Jackie or me, I will come back again.
People deserve a chance to live better when you hear the baby ball. Babylon, you must be fall. Farmer can't get the chance from the mountain of being helicopter area. And I try to couple little things for the car.
Big love, OJ.
Don't forget, see at the street where the music put Jamaica up on the front page. How you feel like half the people them show before the big artists come on the stage. Every pressure we hard. Now walk more people are suffering bad. When you get them to the loop, them a go for man.
So yeah, we have public health relief, we have economic relief. Nana do say a friend say COVID-19 alleviation fund. Onuankasa president no osi na ketua 3 months yen fan koto funding yen fan support COVID-19. Leadership by example right there. You can't take that away from this man right here, to be honest. He's tried. He's doing it. Enya easy say obaka kire nkofo so omuntena fie wo Ghana. Nya na otu omuka. That's the thing. You don't pay them. But Ghanaians are so understanding and they are being supportive of the leadership, and I applaud Ghanaians for that. Wow, it looks like we need to turn the air conditioner on. Summer baby in Georgia. More fire. And another thing I like about Anado's thing, he kept saying, I said, these recommendations are subject to constant reviews. And yes, I have policy that beto honum. Now I have set on stone. No, I have constant review based on our unique condition. So I'm saying right here, man, after sitting here yesterday, showing concern about people crowding in marketplaces, the government has come up with a response for that. And I applaud the leadership for having that bold heart to take that bold decision. That is what Ghana needs right now. Nana Yabua, what do you think? Are we still safe? Do we have need to be concerned? Let's read your comments. Write your comments. Let's read what you think about how we're handling this in Ghana. That's my tune. Hey Google, turn music volume to 10. Rasta is passing through. Pull up that tune, pull it up. I love this one here. Come again, come again. Rasta is passing through, yeah. 1, 2, Rasta is passing through, yeah. I keep it cool, ah. Hey, Google, turn volume to 4. Turn it down. Let's talk to my people. Once again, thank you for watching. And the topic today. Hey, James, how you doing? How is this administration handling the COVID-19 pandemic in Ghana? What could be done better? Adena, if you say yeah, wrong one. Let me look for this video here. Google, turn volume to 5. Hey Google, turn volume to 6. So I saw a video of my own neighborhood, CPC Crowfrom, getting sprayed with disinfectant. Spraying with disinfectant. That's my only concern, the way this is being done. You are putting disinfectant into the air. Somebody's going to breathe it, you know. It is possible that it may land on some food items. You see, we carry food on our head, we sell it. Bananas, apple, watermelon, I say it's child. So let's say I'm a woman carrying watermelon. We'll be out to the channel and then we have chemical spraying. That is what I'm worried about. So we have to be careful. I think there should be some sort of coordination between the health department doing this spraying and the people in the neighborhood. Maybe they know ahead of time that we're gonna do something like that. You know, make sure you cover things, you protect things. If you have, you know, food items that these chemicals are gonna land on, we cover it and protect it before we come and spray. But I mean, to just wake up in the morning with the spray just all over like that is a little bit dangerous. It's concerning. You know, leadership is done good. I mean, considering all the criticisms, I feel it's good. It's okay, Jackie, hold it up.
G-Suite helps my team work smarter and faster. For example, I can open a new document and start collaborating in seconds by typing docs. You can build the future of work using G-Suite today.
Okay, so here is my own neighborhood. Oh, Google is super adverts crowded.
The housing bubble burst.
So this is Ashton Crowfrom. So now if you're spraying Zoom Lion, thank you. I mean, you're spraying the street and the gutters. You know, is you spraying the streets.
Hello,
Yankupon. And the Amaya and then Kumase Abontin Swa, baby, I'm just seeing a crew from. There's some of them of
That's my neighborhood rider.
This infection exercise, I was so crew from Anasi Kumase Abontin, so they said you crew is a summary. When I'm come in pay, I crew from Ashtown Road, Principal Road, and ye is say, cars enter in Chim, Samuel, but Osha, who's a car crampo and Amiano.
Go from Farm Milk, no, Santos Park. Go from Farm Milk, Jonathan Santos Park, Balance Hotel, Atomic.
Dobi one said, Nipa, na Omujana, baby, na Omudi, Omo, and Como. Tiene Cocomighty, Mabomodian said. But the more far a year,
you know where me person who a spraying machine.
Spray a year,
the machine and me fresh. Hey, Contomuano no. Hey, I just neighborhood. Oh, be bro. Ah, that's your neighborhood right there. Shinola. The kind of my Joe. Wow. Esba. No, I don't know. I said me go back to check the spraying machine. Okay, so the spraying machine in there. So this is the spraying machine. Now should baby a sprayer. I hear for a spray good got anymore. We know the targeting there in what? A quanchen hole on the walkway and that spray, this spray in there, I think it's a waste of resources, to be honest with you. Say the waste of the chemical, waste of the whole thing, and I'm and chest and hand sanitizers crime many panomu rather than Zoom Lion taking advantage of this and sending a bill to government. Where I mean, who's a papa, to be honest with you. This kind of spraying, I didn't know asphalt no soon as I didn't know one crew full few almost say cause so doors muna or media call him na car when mundi got the my spray there. I heard the mention them here. Alright, let music back on. Be bro, our neighborhood no. Shinola. Alright. Hey, Google. Turn volume to 7. Good music come back again. Hey Google, turn volume to 8. Saturday afternoon. Positive vibration we are dealing with. Two Rastas passing through. Yeah, I keep it cool. There we have it. So, lockdown, stay away, wash your hands, use the hand sanitizers. That's what we say every day. Don't spread it. We just need to stop the spread. So Nanado, so what the 1 billion cedis for businesses and households. Masa, could you share Umenje Yanyaka, Nanaka, also 1 billion cedis for businesses and households. Be our household, be our house, our holding quantity, I would. It's a carbon man, Obianco. 2 Rasta is passing through, yeah. I keep it cool. All right, so folks, time to go do business. So let me thank everybody. Google. Hey Google, turn volume to 2. So yeah, time to do business. I have to go and do some business calls. Thank you all for watching again. The message today, how do you see the administration today handling the COVID-19 situation? In my opinion, the administration is done really well. I was sitting here yesterday talking about what needs to be done, locking down the place, shutting down the marketplaces, protecting people, public transport needs to cease and desist, and stuff like that. Yesterday, before I went to bed, I heard the president address the nation and talk about all those type of things. I was also concerned about the economic impact it's going to have on an economy like Ghana, whereby a large majority depends on the private sector, and the government says that he's gonna handle it. They know how to bring the economy back. So A+ for Nana. Thank you for watching. I gotta go. Enjoy your weekend. I love you all. Big love, big respect. Stay positive. Wash your hands. Sanitize. Big love.